Good evening, everybody. Welcome to OL Nation, session 4. Welcome, Lawrencians, past, present, the future, friends of Lovedale, everybody. Thank you for being here with us this evening. We've got a great session lined up. And as I said the last time, we've been trying to build bridges. This evening, we are going to cross a 50-year barrier. That's high money and Mandappa, 50 years between the time they left school, between their two passing out years. Separately, I'd like to remind you what OL Nation is all about. We are focusing on thought leadership, mentoring, knowledge sharing, just getting together professionally, talking about aspects of our life where the never given theme runs right through. Without much hesitation, I can tell you it's been a great success so far. The last 3 sessions, we've had in excess of anywhere between 13 to 16,000 views. So that's a lot. And as we go forward, we've been focusing on a couple of other concepts. In October, we will have something special. It's entrepreneurship, and we've got a great team from all over the world who are going to share some really, really solid thoughts with you, ideas, concepts, and initiatives. In November, we've got Adrian Kennedy talking about, well, that's a secret. We are still thinking about December, probably something festive special. That's all for now from me. And I'd like to hand over to Kalpana Kuttaiah, who's my co-host this evening. Kalpana, please come on board and don't forget to unmute yourself. Thank you.
Good evening, everybody. Thank you very much for joining us today. It's a pleasure to be co-host with Rohan for this session. And as he says, we all thoroughly enjoy putting together these sessions for you. A few housekeeping points before I go on, so that I don't forget. If you're all logged into the webinar, please use the chat window below to send us your questions if you have any for the panelists and speakers. If you're on YouTube and Facebook, please post your questions, and a volunteer will pick it up and pass it over to the moderator. Depending on time, we will try our level best to get this to you, answer to you in this session. If not, we'll definitely get back to you following the session. In our preparation for this month, it has brought me immense joy and gratitude. I've been overwhelmed with the realization how rich our Old Laurentian community is in being advocates of knowledge and sources of inspiration. I hope you get to experience that for yourself today with the presentations we've prepared for you. It is my pleasure to introduce the moderator for the first session, Dr. Jeremy Johnson, who will be in conversation with Smriti Rana. Jeremy was in Kailash House when he left school, and if he stayed on, he would be in the batch of 1965. In the early 50s, his father was a senior master, and as a boy, he grew up in Lovedale for the first 10 years of his life. Smriti Rana is from Vindhya House, batch of 1998, and their session is entitled Dying to Know You. Please bear with me as I read out rather than try to attempt to memorize the well-earned accomplishments and laurels of Dr. Johnson's illustrious career. Currently working as an emeritus consultant in palliative medicine, Dr. Jeremy Johnson is the Director of Education and Research at Karunashraya, a 75-bed hospice in Bangalore. He's a fellow of the Royal College of Physicians and Royal College of Radiologists, and he has served as a board member of the Royal Society of Medicine in Palliative Care, the International Fellowship of Rotarian Doctors. Jeremy has previously served as the medical director at Severn Hospice, based in Shrewsbury, UK, and Alpha Palliative Care in Kerala, India. Besides his focus on clinical work, he has set up a collaborative services for patients with progressive neurological conditions and those with end-stage kidney disease. Originally trained as a radiation oncologist, his professional focus has been on pain and symptom management, end-of-life care, service development, and education. He's a well-respected author of several articles published in books and journals, and has made presentations at many international conferences. He's on the editorial board of the Indian Journal of Palliative Care, the International Journal of Palliative Care Research and Treatment, He's also a member of the Association of Palliative Medicine in Great Britain and Ireland, the European Association of Palliative Care, the Indian Association of Palliative Care, the International Association of Hospice and Palliative Care. For all of these laurels, Jeremy has been recognized and honored with an MBE award by the Queen of England for his meritorious work and services to palliative medicine. Jeremy, we are indeed very proud to call you a Lawrentian. Please unmute your mic and take it away. Thanks.
Hello, everyone. Namaste, namaskar. Hegi Dira for those in Bangalore. Thank you, Kalpana, for that lovely introduction and kind words. I should also like to thank you for the opportunity to join in and for you to be part of the organizing committee along with Rohan, Shetty, Murad Lala, Adrian Kennedy, and of course, behind the scenes, Arjun, Nair, and Rashid Kapadia. And to all of you for pulling this together, because the concept is a wonderful one and gives us a whole range of interesting talks already. For me, it's been a very nostalgic and emotive time, really, and it typifies, as you said earlier, the fact that Old Lawrentians, irrespective of their generation, the era, or where they live in the world, have the same values. And I think today it typifies that, the same values that the alma mater gave us, and values that are inculcated into all of us, not least the motto, never give in. It's my great pleasure to be able to introduce Smriti Rana to you, somebody I've known for a long time, I've respected and admired her work. Smriti is trained in integrative and holistic psychological counseling. She began her work in palliative care after losing several members of her family, all within 1 year, due to protracted illnesses. And that year was marked by the conspicuous absence of pain relief. Smriti is Director of Programs at Palliative India, a national registered charitable trust formed in 2003. That trust strives to alleviate health-related suffering. There she heads programs ranging from national outreach, development and integration of curricula, caregiver advocacy, gender equity, pediatric palliative care, advanced care planning, humane end-of-life care, and palliative care in humanitarian settings. The organization demonstrates, educates, advocates for the integration of palliative care into mainstream healthcare and has a footprint in 18 states and 3 union territories throughout India. Through the Trivandrum Institute of Palliative Sciences, and this is Palliative India's flagship program, it's a WHO collaborative center for training and the policy and access to pain relief. Smriti works closely with WHO's Southeast Regional Office to scale up palliative care services in the region, and she's currently engaged in Timor-Leste's Ministry of Health to facilitate balanced access to controlled medicines for that country. Smriti has been guest faculty for 3 consecutive years at Dartmouth University's Healthcare Foundation sessions on global perspectives. And these cover topics centered around palliative care, humanizing pharmaceutical practice, particularly in developing countries, and more recently, innovative responses to the healthcare during this awful pandemic we're all experiencing. Apart from this impressive resume, Smriti is a warm, generous, compassionate in her interactions and passionate about the work. And I've seen this at close hand. With her husband, Rohan, she is a wonderful host and makes a mojito to die for. And that brings me to the topic today, Dying to Meet You. It focuses on palliative care. And before I hand over to Smriti, I'm just going to share the screen one thing with you. It may or may not work. And that is this cartoon that I rather like of Snoopy and Chester Brown. Someday we will all die. True, but on all the other days, we will not. Smriti, I'm handing over to you really, and really to ask you the question, what is palliative care and what does it mean to you?
Thank you, Jeremy, and for that very, very warm introduction. And thanks to the entire OL Nation team for giving us a place at this table, really, because palliative care is something that often gets left out or not talked about. So thank you very much for this opportunity. Jeremy, so to answer your question, what does palliative care mean? I think it's a rather unfamiliar phrase for a lot of people. And I think in a minute we'll discuss what palliative care is not. But palliative care really looks to alleviate all serious health-related suffering. So serious health-related suffering. So if somebody is ill in the family, we recognize that that illness does not just impact the patient, but the family as a whole, and has adverse effects on several domains, whether it's the physical health of the person, the social health of the family, the financial health of the family, and emotional and psychological, of course. And what we attempt to do through palliative care is to pay attention to all these different domains. And we believe in something called total pain, which means that pain experienced by a person, any kind of physical distress experienced by a person, is certainly influenced by the circumstances within which that person exists. And we also recognize spiritual suffering as part of the illness, as part of the constellation of distress that a person experiences. So so basically palliative care includes, but is not just restricted to tools, techniques, and medicine for end-of-life care. And it addresses the patient and the loved one, and also the entire ecosystem that they exist in, like I said. And for example, if a patient has renal failure or a kidney disease, we go beyond their kidneys to the physical, emotional, spiritual needs that that person and their family has. And another very important part of palliative care is the idea of shared decision making. We're strong advocates for the fact that the patient and the family, as a total unit of care, have a say in what they think will contribute to the quality of their lives, rather than just go along with what will prolong their lives, irrespective of the cost. And when I say cost, I mean cost in different ways. And finally, I think a very important component of palliative care is communication. A lot of emphasis is placed on how we communicate as healthcare providers with the people who are entrusted to us, who come into our care, and really walk beside them rather than tell them what is best for them. And so I think the hope is not the hope. The aim is to ensure that medicine is something that is not done to a person, but is done with them for what they think is most important. And I just want to add that why is palliative care so important in a country like India or any low and middle income countries? Because the need for palliative care is greater, because unlike the West, disease-specific treatment does not reach patients adequately or in time. And therefore, unlike the West, people with in the West, you wouldn't think that a child with a congenital anomaly would be a palliative care beneficiary. But here, because there are not enough systems strong enough to support them, they automatically come into our care. So, and we work a lot with people with disabilities. We work with people with other life-limiting conditions, and it's not just life-threatening conditions. Life-limiting means so many things. A person who is bed-bound is alive. They may not be imminently dying, but their life is so limited, and so we step in and try and alleviate that distress as well. So, a bit of a long-winded introduction to palliative care, but that's what palliative care really is in our setting.
Well, I think that's wonderful, because you've kind of knocked two great misconceptions of what people in palliative care do, and that is it's only end of life. That is terribly upsetting, boring, and depressing, and of course it's not. It's very rewarding. I'll say that right at the start. But it's also not just cancer. It may have started with cancer, certainly the modern movement in palliative care, but it's branched out quite quickly, as you rightly say, into end-stage organ failure. So it's not just the cancers people are struggling with, but renal failure, heart disease, and of course, a lot of neurological conditions which are progressing, motor neuron disease, multiple sclerosis. Because I think one of our biggest challenges, not least in India, with the changing elderly population, is dementia.
Yes.
Which is brain failure, and that's coming now within the remit of palliative care. So thank you for dispelling some of those myths that we have, and also setting out the stall. What was your journey into palliative care? How did you come to be? You're a bright young thing looking at the whole world. How did you come into this subject?
Well, I grew up in Ooty. I mean, of course, I went to Lovedale, but even prior to joining Lawrence, I lived in Ooty, and my mum fell in love with Ooty many decades before that. And some of the golfers in the audience will probably know her. She was a avid golfer, and completely an outdoors person. And I think she nurtured that in me as well. And I think, as any Old Laurentian would understand, it would resonate with all of us, that once you spend some time in the Nilgiris, you love the Nilgiris, you want to visit. If you don't, it draws you back. So when I graduated from Lawrence, I went to Delhi to study at Delhi University, and I was keen to study psychology, and really the seeds were sown in Lovedale. We had this wonderful psychology teacher, and I knew instantly that that's what I wanted to do. But when I went to college, my mother was diagnosed with cancer, and that same year, another sister, another cousin, they were also diagnosed with ovarian cancer, and there were several other people in my family who fell sick. I was very close to my mother. She was a single parent, and she meant the world to me. And as her disease progressed, I dropped out of college and I showed up at home because I wanted to be with her. And the minute someone says cancer, you think, oh God, it's a death sentence. So I wanted to be with her, and I ended up spending 6 months with her. And just to point out that when she fell sick, she was whisked away from Ooty because there were no facilities here to look after her. So the closest family was in UP, and so she was taken there. And what we were put through was just, treatment intervention after treatment intervention. And what emerged was this horrific pain as a byproduct. And we were asked to try all kinds of, radical therapies, and we did it. And we made sure she did it, even though there came a point when she said enough, and we said no. In fact, after one particularly horrifying procedure, she was bedridden. Because the procedure had gone wrong. And here is somebody who spent every morning of her life walking the golf course, just confined to her bed and in terrible pain. I think after 6 months, she got sick of me and she threw me out, and she said, get back to college right now. So I came back to Bangalore because Bangalore was a city I loved. And for the next 2 years, I just shuttled between Bangalore and Allahabad. And all we witnessed was pain and mind-numbing. I can't even describe what it was like. So when she died, it was actually a relief because we loved her so much and we didn't want her to go through that. And she died badly. And we'd had very open conversations about her death. And we also decided that once she passed on, we would donate her medication because it was very expensive medication, and we didn't want to, we wanted someone who couldn't afford it to possibly be able to use it. And there was tons of it. So I came back to Bangalore with this suitcase full of medication, and I was so distraught. And then my friends took me out to a bar, and there I randomly met somebody who said, you're looking for a charity that has something to do with cancer. Yeah, my mother does something at this place, so why don't you go have a chat with her? And that brought me straight to Karunashraya, where, your association with Karunashraya was so strong. And I met Gulbano Tan, and she told me, this was a great gesture, but they didn't have any use for these medicines. And I thought, my God, you have such a beautiful facility with 50 beds at the time. There were 50 beds. And I said, what do you mean you can't use this medicine? And she said, because what we do here is palliative care. And I said, what's that? And she took me for a tour around Karunashraya. And if anyone's been to Karunashraya, you know what a beautiful place it is, unlike a hospital. And it has these water bodies and all of this wonderful greenery. And I didn't hear anybody screaming in pain, which was shocking to me. And so Gulbanu actually sat down and explained what palliative care was. And in that moment, and this was 20 days after my mother had died, the thing that emerged in me, the emotion that emerged in me was absolute rage. I was so angry that this was a possibility and nobody had told us about it. And I immediately, I said, I want to be a volunteer, because somewhere, in my head, I thought that if I volunteered here, I'll get some closure. She was very kind. She said, you've been through too many bereavements in the last 6 months. So not now, maybe a little later. I insisted. They let me, and I lasted a month. And then I went back to college. A year later, I came back and I said, I would like to volunteer again. And this time I have my emotions in check. And that's when I met you. Very fleetingly. And I think when I moved to Masnagudi, where I live now, I lost touch with palliative care for a couple of years. And then one day you and Penny, your wife, walk in and we sit down to lunch, and you tell me about palliative care, and I say yes. And I think Penny said, didn't I see you in Karunashraya? And I was so shocked that she remembered me. And I think for people who don't know, Jeremy and I found that that's when we discovered we were both Old Lawrentians, and that both of us had Nepali blood in us. Jeremy's grandmother is Nepali. And so it just seemed like, this jigsaw falling into place. And thanks to you guys, I attended my first conference, and that's where I met Dr. Raj Gopal, who I work with now. And that's how it started for me. So we were accidental mentor and mentee. But yeah, that's how it started for me. And I think you have a pretty challenging story as well, right? Like how you got into palliative care.
Well, thank you, Smriti, for sharing that. I mean, one thing is from that is my good friend Nagesh Simha, who's medical director at Karunashraya, always says, the universe speaks, and it often brings people together in most, unusual ways. And these little things kindle each other. And it has been interesting for me, because I started off wanting to be a surgeon. And my professor of surgery got me a fellowship looking at antigens on tumor cells, because we were just on the post-transplantation kidney transplant era. And we were looking at this very early cutting-edge stuff, looking at sticking cytotoxic drugs onto antibodies and targeting cancer cells, which led me into becoming interested in cancer, which led me on to training in oncology. And there was a time when I was thinking, well, we're not actually we're curing a lot of patients, we're treating some of them very well. But there was a seminal moment when I was a consultant I was working with who was very aggressive with chemotherapy, and had a young lady in her 30s dying of metastatic ovarian cancer with a family around her. And the only way this consultant knew how to treat malignant bowel obstruction was to give her more chemotherapy. And she died literally with the drugs running into her veins, vomiting profusely. And I thought there had to be a better way. And fortunately, we had somebody from a local hospice with us who took me aside and said, look, you can make a big difference. And it's not always through not nasty treatments. And through that, I became very interested in palliative care. And it was an interesting journey, really, from literally working at molecular level through to working through cancers, through to patients, and then to people, which is what palliative care is all about. It's actually about what makes people take who they are, what their individual needs are. And I think the transformation into palliative care has been a very exciting one, a lovely one. When I wanted to leave oncology, a lot of colleagues said, why going to palliative medicine? It's a dead-end subject. There's nothing there. It's not academic. There's no research, and you'll be depressed all the time. How wrong they all were. And all I could say is, it just comes back to the never give in motto of the school. Don't always just give in to what other people are telling you in peer pressure. So for the current Lawrentians, and indeed the ones recently qualified, be prepared to plow your own furrow and not give in to outside interventions always. Obviously, take advice, listen to what people say, but make your own mind up on the basis of what you're hearing. So for me, it was a lovely transformation. And you talked about journeys, as indeed did Murad Lala, when he talked about climbing up Everest, not just a physical journey, but a spiritual journey. And I think there's an old saying in an African proverb that if you want to travel fast and far, go alone. But if you want to travel well for it to be meaningful, then travel with company. And I think that's what we do in palliative care. We travel with people on their journeys. And I think it's always it's a wonderful opportunity. And we're very privileged actually to be part of somebody's lives, even towards us, even if it's towards the end of their life. So I'm sorry to hear about your mother and your family. Do you think in the last sort of 20 years or so things have changed in India, and has palliative care made an impact in the Indian setting?
I think we are in an age of transition now, but I don't think the needle is moving as fast as it should. We're making incredible advancements in technology when India is not far behind as far as cutting edge technology in medicine goes. But what that's really doing is that people are living longer. And like you said, more people are living with dementia, with Alzheimer's, with all kinds of things. But palliative care is not keeping pace. And it sort of goes back to, the fact that there is so much emphasis that is placed on diagnosis, treatment, and cure. And there's a rhetoric of war that is used, that, survivor, you've won the battle or you've lost the battle, or, and coming from Lawrence, we are also familiar with military language. And it makes me wonder why we're using the language of war when we're talking about human lives in this context. The quality of life doesn't really figure. And less than, I think, 2% of India has access to palliative care. We're the largest manufacturers of legal opium in the world, from which morphine is made. And yet till 2014 is when the law was amended. Up until then, our laws were so draconian and prohibitive that we were denying pain relief to our own people. And, so that law was changed it was amended in 2014. The rules came out in 2015. But yet, 5 years down the line, most state governments have not implemented this change. And in fact, part of our national outreach program, we find that when we go and speak with drug controllers or we speak with people in charge, they're not aware that the law has been amended. So then it becomes our role to sort of educate and then facilitate. What's really happening is that the palliative care movement is being taken forward by champions in civil society, champions within the medical fraternity. And yet we are considered to be, outsiders in a sense, or too soft a science. And earlier I was, I took umbrage with it, but I'm okay for us to be a soft science because that means we're more humane. So it's an uphill task, I think, but every single one of us has known or will know somebody who is ill. Every single one of us has been or will be a caregiver or will need care. And we need to have these conversations about it. But, in India, we don't talk about death and we don't talk about sex. I don't know how we got to this, it's like we don't talk about the two things that are rampant. And by not talking about it, we are doing ourselves a great disservice because palliative care is for everybody. And it's not just from the time of diagnosis. Not just at the end of life, it's from diagnosis. Unfortunately, the referral system here kicks in too late. And when there's nothing more we can do, that's when the palliative care referrals come in, if at all. Most of the time in India, they don't. And that's one of the reasons why palliative care has come to be associated with terminal illness. The other problem, Jeremy, is that when you talk to somebody about palliative care, they automatically see it as giving up. And nobody wants to give up. Nobody wants to give in that sense. So it's seen as the loser's way out or something. But lived experiences shared by people who have benefited from palliative care will illustrate just how incredible, what an incredible difference it can make to someone's quality of life. So we are nowhere close to where we should be. There has been a change. Yes, there have been many, many incredible champions for the cause, some of whom you've worked very closely with, some of whom I have the privilege of knowing and learning from today. But we have a huge task on our hands. And I think one of the key things there that we need is demand generation. People need to know that it is their right to be free of pain, and that we have the means, we have the resources, but we have to make those two dots join. That's it. Yeah.
I think it's interesting you mentioned the change in the NDPS Act in 2014. I mean, it was absolutely draconian before that. And for those of you, Old Lawrentians and others who don't know, in India, availability of controlled substances is not within the remit of the Ministry of Health. It's actually under Customs and Excise, because in the old days, when the British were there back in the 1840s or whatever, it was a trading substance on the old Silk Road, and hence it was regarded as a commodity and not a medicine. And until very recently, it's still been regarded as such, and people forget that drugs like morphine and various other opioids actually have a major part to play, not just in pain control, but also in breathlessness and other situations. And a lot of people are very afraid to use it. So training and education is also something we need to, not just with the drug controllers, but also our colleagues. And in doing that, and people think, oh, it's all about just pain control, but in fact, we look at all the symptoms. In that sense, we're not just specialists, but also very generalists in looking at the whole body and various systems. It's interesting what you said about the right, and I could I come back to picking you up on the point about it being a right. We know that, again, in 2014, the Lien Foundation Singapore commissioned The Economist to look at quality of death around the world. And out of the 80 countries surveyed, India was 67.
Yeah.
And we're very keen to push that up, well up into the 10s and 20s. And my colleague, colleagues Roop Goswami and Rajmani wrote about India not being a country to die in.
Yes.
And the need for education, training, and spreading the word. So where do you feel the rights issue comes in terms of humanitarian rights?
I think the UN Rapporteur for Torture talked about the fact that withholding pain relief is the equivalent of inflicting torture. And that was recognized. Somehow there seems to be this this notion that there's a hierarchy between the provider and the recipient, especially in healthcare. There is a power dynamic that is implicit, even if it may not be expressed. And when you enter the healthcare system, you're usually at your most vulnerable. You're sick, you're depleted, and it has a whole lot of other repercussions, doesn't it? So your family dynamics change, your allocation of funds changes. People are taken out of school so that money can go towards treatment. I mean, there was a report that came out in 2017 that said that 55 million Indians are pushed below the poverty line annually because of healthcare expenses. That's crazy. And 1 in 5 suicides in India are committed by people who are living with a chronic illness. Now, the reasons for that are varied. It could be because they're in so much pain, or it could be that they don't want to be that financial burden on that family. But these are staggering and horrifying statistics, right? So where do I stand on the rights issue is that asking for appropriate, affordable care is your right. A universal health coverage, it talks about access to quality healthcare where you need it, when you need it, and it has to be affordable. And WHO has outlined that comprehensive health coverage has 5 components to it, and they've listed it out. It's preventive, promotive, curative, rehabilitative, and palliative. But somehow we're not looking that much at the palliative angle of things. And there is this push to, cure it at any cost. To quote Roop Gursahani, I mean, I've heard him say this, modern day hospitals are like fortresses where the rich can't get out and the poor can't get in. And, when we talk about people who are marginalized, even within palliative care, we talk about women, we talk about children, we talk about the elderly, especially elderly people living alone. But paradoxically, one of the most marginalized communities are the affluent, because you will go to a private hospital with extremely high-tech interventions, but very few of them have the provision to relieve you of your pain. So it is a right, it is a human right to dignity. It's mentioned in our constitution. Our constitution talks about the right to dignity. And what is dignity? How can you have dignity when when you're not allowed to live a life of quality? And so it is a right, I think, and that's one of the key points of advocacy that we work with, that it is your right, ask for it, there's nothing wrong. The problem is that a lot of people seem to equate, and it's a very widespread myth, Jeremy, and I'm going to ask you also to sort of expand on what I'm going to bring up, is that a lot of people believe that palliative care is the equivalent of euthanasia. And they, withholding and withdrawing of life support is seen as euthanasia. And our court and again, after the Aruna Shanbag case, the court talked about passive euthanasia. They recognized the advance directives as being valid, but they went on to lay down procedure of how you can bring that into force, and that procedure is impossible. So that's where we're at the moment, and I really think that this is why we need to engage community more, because these are conversations that begin at home. If you can sit down with your family and say, and this is, again, it's not easy, but if you can sit with your family and say, what would you like if you were to fall seriously sick? What is acceptable to you? Are you okay to be wheelchair bound? Or are you okay to be almost completely dependent on your family members? I mean, and these are conversations to be had while we are healthy. Because we can't have these conversations when when emotions are volatile and people are already sick. And so that's where we're at. Unfortunately, it's not institutionalized, but I think these conversations need to begin at home.
Several topics to come back to there, Smriti, and I know we're sort of time bound. Very quickly, one thing to reinforce what you said, 85 or 88% of all healthcare expenses in India is out of pocket.
Yes.
There's no state fund, very little state funded healthcare. And something like 78% of patients need the end of life care on ventilators or on hospitals actually leave because they can't afford to continue, and they leave against medical advice with the LAMA, L-A-M-A statistic. And coming on to the thing about withdrawing, can I just say euthanasia, the word, just to quash it completely.
Yes.
Passive euthanasia should never be, it should be conscribed to the dustbin. There is no such thing. If you're going to kill somebody, you kill them. So passive euthanasia is not in the vocabulary. In ICMR, a lot of us had a meeting and came up with definitions which have been accepted within palliative care, and that is one that is not an acceptable definition. I think palliative care physicians have generally not subscribed to euthanasia because there was a view that if you did good palliative care, you wouldn't need euthanasia. I mean, that may be a bit naive, and I accept that. But this whole question about withdrawing and withholding, it's peculiar to India in a way. Other countries, the USA, UK, many parts of the world, Australia, don't see that. and as killing somebody. It's actually very much, and this is enshrined in English law, that is the patient's right. And also, to some degree, the doctor's right, having discussed it with the patient, to actually withdraw futile treatments. And this is why I come to the point, they have to be futile. That many are very often in India, people end up on ICU being ventilated when actually, they're in the last few days of life. And it costs the families, as you say, absolute fortune when it's totally unnecessary. And there have been, I know IAPC, the Indian Association of Palliative Care, and the Council have submitted to the High Court, to the Supreme Court, and to government clarification on this. They've actually given, is yet to be enacted. And coming back to what you were saying about palliative care amongst the politicians, I think there are only about 3 states, possibly 4. Kerala, where you've been working, was the lead in taking out palliative care policy for the state, followed by Maharashtra and then Karnataka. Often not enacted. I think Tamil Nadu, this time last year, were bringing something in.
Yeah.
But whether it's actually come to pass is very different. And I think, you talked about communication. You live in Masnaguri literally amongst elephants. They brush against your door every night. But what's frightening is actually the elephant in the room. This whole thing about communication, about not discussing things. You've flagged up communication. Do you want to just say why it's important, particularly at the end of life for many people?
I think, well, from the advanced care planning perspective, which is what I touched upon, about having the conversations at home. Once somebody is sick and once they are in advanced stages of the disease, it is not possible to really have, very rational conversations that are not riddled with emotion, right? And so there are 2 parts to that. One is, as healthcare providers, we need to be able to assist the family to navigate those very difficult conversations. And how do we do that? How many physicians, and I'm not talking about, well, there's nurses, there's the paramedics, there's all of that, but how many physicians have been trained to have those conversations? Not many. I mean, it is sort of touched upon. Now, in 2019, the Medical Council of India introduced the 8COM module, which is attitude, ethics, and communication, in addition to some aspects of pain relief and end-of-life care. And I'm so glad that it's now being made to be a part of the curriculum, because prior to this, I don't think a lot of emphasis was placed on that. That's not to say that there aren't compassionate and thoughtful doctors who take the time to actually have these conversations. But the vast majority find it difficult, and that is being illustrated very, very clearly in this pandemic, where the mortality rate is so high and the volumes of people that the healthcare system is having to deal with. A lot of healthcare systems across the world are crumbling under the load. And we are hearing stories from people in the West, from Europe, from the US, of physicians and nurses and healthcare providers just breaking down because they're experiencing the trauma of having to deal with it, and they don't know what to say, right? So in India, I recently heard from a doctor that he saw 24 deaths in 7 days, COVID deaths. And one of the patients with COVID-19, when he died, 3 of his family members committed suicide. And when that happened, 2 of the nurses on his team quit because they just couldn't, get their heads around it. Now, we are running programs quick programs, 5-day programs that are just geared and engineered to help healthcare providers deal with these very, very vital skills. And the feedback we're getting is tremendous, saying, wow, I mean, I didn't know that I could have had this conversation in such a short span of time. And that's what palliative care has done over the years, right? It's really brought it to a level of art to have these conversations, whether the person has weeks, months, or days to live. So why is it important to have this conversation? Because if we don't have these conversations, what ends up happening is that people die terrible deaths, hooked up to inappropriate and futile, machines and all kinds of things. And the family that lives on has to live with that. And there is multi-generational trauma that can also happen. I mean, all of us at some level have either experienced it or we have witnessed it. So communication is vital. It's like a skill. If you have to, as a doctor, as a healthcare provider, or as a psychologist, if we understand the importance of constantly upgrading our skill set, we need to do the same with our communication as well. And it's not something that you just learn and there's a formula to it. You have to bring a lot of yourself to that conversation and see where the other person is at. I can't go and speak to somebody who doesn't understand jargon and bombard them with jargon. I need to be able to break it down in a way that they can assimilate it. Yes.
Smriti, I think we're running out of time. So, you've covered so much, not least. I think one thing that's come out to me in your talk is that doctors can't do it on their own. They need a team of people around them, and that team needs to be cohesive and efficient in how it works and support each other, particularly as you referred to during this COVID crisis. And, this has highlighted the need for palliative care to other professionals. I think sometimes the hardest group we have to convince, apart from the population in general and politicians, is our fellow professionals who don't see the need for palliative care. But COVID has thrown this very much into the highlight. I think it's time really to pass you back to Kalpana. Smriti, we could talk all day, and I love talking with you and hearing your views on things. I'm very much with you on all of that. Just a big, sincere thank you on behalf of Lawrentians all over the world in various ages. Thank you so much for your contribution today. Take care.
Thank you, Jeremy. Thank you.
Jeremy and Smriti, truly, that was just phenomenal. Thank you both so much. You have shared with us such meaningful, insightful conversations and thoughts, and I truly, truly appreciate it. And Smriti, if you didn't have the opportunity to highlight something for us, what last thoughts would you leave us with for us to contemplate on or consider going forward?
I think what I'd like to just share with everybody is that palliative care is for everybody. And when I say it's for everybody, it's not just in terms of receiving it, it's in terms of getting involved. You don't have to be a healthcare provider to plug into the palliative care movement. You don't have to be specially trained. As long as you have a core of humanity, there is a place for you. We constantly invite people to engage with us, become our champions, and take the message forward. So you could be an accountant, you could be an architect, whatever. There's a place for everybody, because this affects all of us. And certainly there is one last thing, which is there are people to help you have these conversations within your own homes. And I think all of us in the palliative care community will be delighted to engage in those conversations and to enable those conversations. So that's it, Kalpana. Thank you.
Thank you, Smriti. Thank you so very much. And now I will pass this over to Rohan to introduce the next conversation, which will be with Viju Parameshwar, batch of 1968, Nilgiri House, and the headmaster of the school. Rohan?
Thank you very much, Kalpana. I just want to ask you, you seem to have a connection with the healthcare industry, as I think we've not introduced you really well enough, as a very successful architect with Perkinsonville. And you seem to have a connection with the healthcare industry. What would that be?
I work with the design firm I work in, like you said, Perkinsonville. We actually build hospitals, and they range from all scale, sizes, providing all kinds of care. And much of what Smriti and Jeremy spoke about resonated very well with me, because that's what we deal with, trying to give the utmost patient satisfaction, patient consideration, as well as for their families and the caregivers. Like she mentioned, everybody who takes care of people who are unwell and in their most vulnerable moments. That's what design does, and that plays a big role in being able to execute that in a space that is humane and meaningful and joyful, actually, to take care of people.
Okay, thanks, Kalpana. Your blurb and profile says you've been to over 70 countries, and this complex cultural experience has translated itself into something very unique. Is there anything special that you've created that has captured the essence of this extensive travel?
I think when you travel the world and when your mind opens to be informed to many multiple different things, and you have to think beyond the information that you're based with and you're educated with, you have to absorb and be able to provide in the context that it needs to be received in. So that's what I've learned from all my travels, and I'm always curious to learn more. So besides that, I like photography, which is what we have another session on. So that's the reason I travel. But thanks for giving me the opportunity to say so.
Thank you, and thank you very much for being, my co-host, and of course, one of the solid pillars of our OL Nation working group.
It's a pleasure.
Thanks,
it's
Kalpana.
A pleasure.
And now,
thank you, Rohan.
Thank you. And now we are on to Viju Parameshwar. Viju is Nilgiri batch of 1968. Viju is a chemical engineer, and he recently retired. I don't really believe in retirement. He's still active, isn't he? He looks very active. And he was vice president and general manager of Kluber Lubrication, part of the Freudenberg group of companies. He has also worked with the Tata Administrative Services. He's done his BTech at IIT and a master's in Syracuse, and so on and so on and so forth. A very, very well qualified, very articulate gentleman. He's been working with the Old Lawrencians Association for many years, and he's not going anywhere anytime soon. He's helped us with the formulation of the bylaws and so many legal structures. Viju was also part of the PTA of Lovedale, and also was the past president of the Old Lawrencians Association. Nice to have you here, Viju. I think you've just come out of the OLA General Assembly. Thank you for staying with the OL theme right throughout the entire day today. And I hand over to you.
Thank you very much, Rohan. And thanks, Smriti and Jeremy, for such a wonderful conversation. Well, I'm here to give you an update on the OLA. All past webinars, you've been hearing from the committee on what's happening with the OLA, what's the latest going on. Today, I'll give you a slightly different perspective. Why should you have an OLA? And why should you be a member of it? One thing I've always noticed when I meet people and they hear that I'm from Lawrence School, the first reaction is you have such a strong alumni. And that's normally said with a fair amount of jealousy. So it seems to imply that people outside see an advantage in this bonding of the alumni. And there seems to be something about this outside perspective that sees things that maybe some of us don't see from inside. And if you look around, you find that many strong educational institutions have similar bonded alumni. Whether it's the schools like Doon and Mayo and Sanard, or whether it's universities like Harvard and Stanford and so on, you find that strong alumni is one of the characteristics of good educational institutions. So I think that we have that, and it seems to be a source of support and help, not just for individuals, but also for the institution, for the school itself. But if we were left to ourselves without an organization like the OLA, this bond is likely to be restricted to the people we knew from school, our own batch or one or two batches up or down. But an organization helps structure that, helps keep it going in a more formal way, and doesn't leave it to chance for sometimes people to be better bonded, sometimes not. Also gives you an opportunity to get to know people across generations who are alumni. I have many good friends amongst the alumni who I didn't know in school, and I got to meet only later. So I see these as the great advantages of not only having a strong alumni, but an organization to keep that going. Now, is the OLA working well? I think it's working better and better as the years go by, can always be still better. And that depends on you. The more you get involved, the more you ask for what you want and influence the direction in which the association moves, the better it'll be. In some ways, the lockdown and the pandemic has actually helped improve things by having interactions online like this. And I'm sure that the association, the OL Association, will get better and better and stronger. So that's, I think, why we have an OLA, and that's why you should be more involved. Thank you for that. Now I'd like to hand over to the headmaster, Mr. Prabhakaran Nair. And sir, please unmute yourself as you come online. Thank you. So you need to unmute yourself.
Yeah, yes, done. You can hear me, Mr. Rohan?
Very clear, sir.
Yeah. First of all, good evening. It was a very informative talk. In fact, though I stand here as a part of organization, representing the organization, in fact, I must appreciate and congratulate the initiative taken by your team, Rohan and OL Nation team. And I was talking to myself while I was listening to it, because we need someone like Smriti, Rana to come and talk to the students. The things which you have mentioned, it's not in the curriculum, it's not in the syllabus. These are something like life skills which is required to be, communicated to our students, so that they come good human beings, they come committed students and committed citizens of the country tomorrow. So definitely, it's an eye-opening session. Thank you, Rohan, for introducing such a galaxy of experts, and a lot of takeaway from that. I will definitely wait for this pandemic situation to clear out, so that I can also utilize the collective wisdom of such experienced people for the betterment and enriching the knowledge base of our students. And coming back to the point, there are not many changes. The pandemic still goes on. Our online classes are going on. Assessment is going on. Apart from the students' interaction, the face-to-face interaction, everything else is going on. Right now, last week, a couple of weeks back, in fact, the new Board of Governors was constituted, and there's no change in the chairman. Chairman is Mr. Keshav Desiraju, and there are many members. It's there in the website. And of course, there are three OL members there. One is Mr. Sudhir Rao, the one is Mr. Ramesh Venkateswaran, ex-headmaster, and also Mr. Ram Mohan Rao. So these OLs are there in the newly constituted governing body, and life is going on. And we are discussing a lot of things in education now. You all know the National Policy of Education, NEP 2020, is launched, and another maybe 1 or 2 years, we're just waiting for the clarity from the Ministry of Education that it's going to be implemented all over the country. And that policy is going to be the future of the school, future of the country, and future of the coming generation. So there are a lot of pedagogical changes, right from the pedagogical structure towards implementation, and also towards the learning outcomes. All these are going to change. First of all, on a lower end, like foundational stage, it's going to change. The structure is going to change from 10 plus 2 plus 3 to 5 plus 3 plus 3 plus 4. So there may not be much of a change on the lower end, first, second, third, and all, because we don't have classes up to class 5th, but 5th onwards, there is going to be a lot of changes. And the staff and our experts are working on it to make the transition smoothly, and also waiting for certain clarities in that decision. But one thing I must tell you, that the new education policy emphasizes on experiential learning, number one, a focus on linguistic diversity, and it also makes education system more open. Right now, we have we have a stereotype system that, if you are good in so-and-so, physics, chemistry, biology, one group, then you have another group with business studies, commerce, economics, then you have humanities group. And this structured hierarchy is going to change. After 10th, after moving to higher secondary, you can opt for any subject choice. It's going to be more flexible. That is something which is great. And in that situation, a lot of learning inputs can be inculcated. And in higher education, after class 12th, it's going to be a 4-year degree course instead of 3, where you have multiple exit and entry level. Even if you are missing out 1 year or 2 year, you can skip. You can continue even after 1 year or 2 years later, if there is any unpredictable situation as such. Plus, if you're completing 1 year, you get a certificate. Second year, it will be a diploma. Third year, it's degree. And fourth year, it will be an add-on to your research. MPhil is going to be removed. Then MA, post-graduation, MA, MLC, and PhD will be coming. A lot of things have been put into it, and a lot of discussion and research has been going on. So that National Policy of Education 2020 is going to make a lot of changes in the years to come. Again, if you actually look at it, we have a galaxy of experts. Like once, Rohan keep on introducing them one after other. All those great people will be one of the add-on to my students and the coming, youngsters, because this policy also emphasizes on skills, emphasis on talent, emphasis on experiential learning, which is a big change from the present stereotype. I'm looking forward to that change. Okay, and since you have a large number of, please.
So I think like everybody here has said, this online COVID situation we look at the brighter side of everything, and Absolutely. It's a great opportunity. And trust me, I've been in touch with people. Now you'll look at our next session. She left school 70 years ago, and she's still rocking. And the amount of energy and knowledge, entire range of, it's there. But we need to share it. I think we've got a right platform. We've got 2 or 3 platforms. We've got OL Nation, what this is, 4th Saturday of every month. We've got OL Assembly, which is all about our nostalgia and love and affection for school. And of course, you're doing the very specific student-focused knowledge sharing. And there are scores of people. In fact, I've been trying to schedule, things, and now I'm already into Jan. So I think there's a great opportunity. We'll have, and when you talk about transition in the new education policy, transition points are very important in the life of any institution. And at that particular point, it's very good to have good leadership. And we are really, as old students, we are really grateful, and we are lucky that an individual such as yourself, who's so focused on this and so open-minded to this, and then you will steer the school in this. I mean, for example, all of us in my OL Nation working group, this Zoom thing is new for us. It's brand new. And I can only wonder what the children are thinking. They've been 10 plus 2, and now it's a completely new.
Completely changed. Thank you, Rohan. One thing I just would like to make it very clear that, these transitions, these changes are very important, number one. And number two, at the end of it, we have to train our children to face the change and adapt and evolve. That is the ultimate aim of education, because we really don't know 10 years down the line what's going to happen. Yeah, that's true. That way, you're also opening up an excellent opportunity to us to see those great, the wisdom, the great intellectuals whom we can derive a lot of energy and enthusiasm. Thank you once again.
Thank you so much, sir. And now, once again, we have Kalpana back again to take us and lead us into the next session. Welcome back, Kalpana. And this one I'm really looking forward to. Completely 2 different sets this evening. Smriti and Jeremy really talking about, stuff, the unspoken. I'm not too sure whether he shared the photo of the elephant in the room, but that was what it was all about. Thank you and welcome again, Kalpana.
Thank you, Rohan. Thank you so very much. I'm excited to tell you all about the third session, a third piece of segment of this session. We will have K.C. Mandappa, Vindhya House, batch of 2002, who will be in conversation with High Money, who was from Willingdon House from the batch of 1950. A very, very special person indeed. She has been phenomenal in sharing her experiences with us, and I hope you enjoy the conversations as well. To just give you a little bit of background on Mandappa, he's a prolific, versatile photographer with over 12 years of experience in the field of photography. While his background is in advertising and photography, he focuses on travel, social, and environmental documentary. He has worked with a multitude of brands, including Amazon, but his best credentials would be perhaps finishing as a finalist on Mission Cover Shot, a reality photo show for photographers on the National Geographic Channel. His work has been seen in BBC Worldwide, Nat Geo, Traveler, and Sevens magazine. Combining his writing experience along with his photography skill, it has led Mandappa to create several films. These include corporate and digital films and 5 documentaries that have aired on the National Geographic Channel. His creativity and pursuit for work in the social and environmental space has helped steer focus on using photography for good, for the betterment of the environment and the world. Mandappa, please unmute your mic and take it away.
Thank you so much for that introduction, Kalpana. I think that was really kind. But I think you're as excited as I am in introducing our guest. So hello and welcome to everybody, my fellow Lawrencians and Lawrencians. I didn't know that it was pronounced as Lawrencians back in the day, but thanks to getting to know the most inspirational person that I have met in a very long time, I got to know that it was pronounced as Lawrencians back in the day. Time, distance, and age melt away when you hold a photograph in your hand, and so it is with this inspirational icon. From the boondocks of Lovedale to London, hers is a story that's entrenched in our motto of never give in. I am grateful for this opportunity to introduce the legendary photographer and England's first ever female sports photographer, the legend herself, Madam High Money. Please unmute yourself and join us.
Can you hear me?
Yes.
Oh, good. So am I unmuted?
Yes.
So, thank you for that incredible introduction. And I feel very humbled to follow our previous guests, because the work they do, I have so much respect for them. And I think I've got to follow them, and I'm just a photographer. I feel really humbled, but you've asked me here, so I'm here, so whatever.
I think you have an incredible story to share. And as you know, our worlds couldn't have been further apart, but I think we share 3 things in common, which is football, photography, and of course, Lawrence School, Lovedale. So tell us about your
in the reverse order. In the reverse order.
In the reverse order. So now could you tell us about your time in Lawrence?
Yes, look, they're the best. I wouldn't say they're the best years of my life, but I would say they were the foundation stones. I didn't realize it at the time, but it was the foundation stone that was going to see me through the most peculiar life that was dealt me as I left the school. And what kept me going throughout all those trials and tribulations further down the line was the fact that this never give in was drummed into us. And I think if I didn't have that military background, the boarding school background, and the never give in, I think I would have crumbled it, maybe this 3rd or 4th obstacle. But I kept on till I got my photographer's union card, and that was quite something.
I'm going to start sharing some of your images.
Okay. Yeah, so basically, when I think back of my life, I thought, how did that little baby that was in an orphanage in Bangalore, in Kensington Road, Bangalore, end up in Lovedale School? And the rest of the history, I cannot believe that from the orphanage to the palace, meaning Crystal Palace, not like our previous guest who ended up at Buckingham Palace to receive his MBE. And this is my mother, and I'm the one with the hat, and my two younger sisters when we got to Lovedale. I'm looking so happy because I had no idea what was ahead of us. So, yep, so that's then. And when I left Lovedale School, I was given my first job. Well, it was forced upon me. And I have this here, I don't know if you could see, Verona Studios, Mahatma Gandhi Road, Bangalore. Only it wasn't called Mahatma Gandhi Road, it was called South Parade at the time. And my first job was to be receptionist at this new studio that had opened up at Mahatma Gandhi Road. And the woman who owned it, she took a dislike to me and immediately, and she said, instead of speaking to me, she would leave me notes. Hyacinth, you're not doing this. Hyacinth, your desk is untidy. And eventually it was so much better to get out of her hair and just try and go into the dark room and hide so I could learn a little bit about how to develop. I wasn't going to be a photographer. I was going to be a shorthand typist because that's what I was apparently taking training for. So it seems to me like the photography thing was seeping in surreptitiously through the back door. So there I was at Verona Photography, ending up working in the darkroom, learning how to develop photographs, just so I could hide away from this horrible woman who was my boss.
I think you told me, you've always been somehow involved in photography even before you moved from India, like saying how you were in Bangalore. What was that move like, moving from Lawrence to London?
Well, I was forced to go. It wasn't my choice because India was in a turmoil. There was the Hindus and the Muslims, and I'm a Roman Catholic. Are you British? Are you Indian? When you're sort of neither anything, you're neither anything. You're kind of half caste, halfway in the middle, and you're not. So my mother did everything in her power to get her three daughters eventually to England. So I was in the first batch that she sent out. And she, with my younger sister, and we had nobody in England that we knew. It was just in a boarding house address. She gave me this box brownie camera, which I have here somewhere. And she said, when you get settled in England, you've got to take a photograph of Buckingham Palace. So I could show all my friends here in Bangalore that you see, I never get my girls to England. You know, there they are. This is a picture of Buckingham Palace. Well, I never got around to photographing Buckingham Palace, but I ended up at Crystal Palace, which is a football club. And the picture on the right is when I went back 40 odd years later to Mumbai, and I wanted to find that exact spot at Victoria Terminus Station, because the agony and the sorrow I had in my heart to know I've got to be shipped off to some foreign country. And I went back to find that same spot, and there it is. Somebody's been selling razor blades by the look of it beside it. Yeah, so I got that sort of circle completed when I went back to India after 40 odd years.
How did you get into photography once you went all the way to London?
Well, it all started when I got married and I had my first baby. Now, this picture is to represent how precious one roll of film was to me, because my mother, my sister, my best friends at school, everybody that was my previous life was still living in Bangalore. And I got married and I got no one to share this beautiful baby that I had, Lisa. So I had one roll of film and it had 8 exposures. So it was expensive to buy. It took a week to 10 days to develop. It took a week to 10 days to send the photographs to Bangalore, and that long again to come back to say, what a lovely baby, etc. In the meantime, she's grown a bit. So this cycle was going on. So every single image was really, really important. With 8 exposures on a roll of film with my box brownie camera, I had to make sure that I would capture everything I needed to capture. In other words, it had to tell a story in 8 images not like today, bang, bang, bang with your mobile phone. So that's how it all started. And this is my first, isn't she beautiful? This is my first picture of my first child, Lisa. And that's when it kicked in, this photography thing. And then later,
moments is a big thing to do with photography, because even for me, it was about being able to capture what I saw, which was very different because of where I was from, since I was from the smaller towns once I got to the city, you know. So I think sharing those moments become really important. But what made you start capturing more images apart from sharing it back? Like, what are the kind of moments that you like to capture?
well, it's just whatever I'm photographing has to show life. It has to show energy. I don't like, I'm not like a portrait photographer. So my family grew to 3 more sons after that. And if you look at these, all I ever wanted to do was just like, instead of a normal family, just come on, sit down, let me take a picture. It had to be energy. It just had to be split-second images captured. For some reason, that's all I wanted to do, because it made me feel that it showed their vitality, their energy. So these are my children in the garden, and they are, and of course on the beach there, but everything, I never liked to photograph stillness for some reason. I had no photography training, and nobody told me this is what you do. It's my instinct. So where it came from, I don't know, but that's how it was. So then when my son was, sorry.
I said, I think that's true to your personality as well, because you're always full of energy and not very, you know what I mean, not very staid. So I think that translates straight into the images as well.
Do you think so? Do you think my body language is I'm full of energy? I guess I am, considering my age.
Yes.
Yeah, I'm doing pretty damn well, touch wood. So I mean, for instance, when the cousins came to visit, instead of saying, oh, let's get a photograph, all sit down, I said, why don't you hold hands? And when I say count up to 3, when I come to 3, run towards me. And this is the picture, and I think it's fabulous. But the average mummy would sit down with them and just get them in a little group and just say, oh, I've got all the cousins together with my children. But no, I have to say, hold hands. When I say 3, run towards me. And then you get laughter, you get expressions. You know, it just came natural to me.
So how did that go from shooting in your backyard and shooting your children to getting into sports photography?
Well, that was purely an accident as well, because it was one of my sons, Martin, it was his 7th birthday, and we were walking back from school, and I said to all of them, and I said, what do you want to do on your birthday? And he said, I want to go to the palace. All my friends have been and I haven't been. And I said, why would you want to go to the palace? You can't guarantee the Queen's going to be there. And he said, not that palace, silly. I mean Crystal Palace. And he said, it's a football club. The minute he mentioned the F word, football, I shrugged, absolutely had this horror. And I said, oh, well, if it's football, your father will have to take you. So we went home and I spoke to my husband and I said, this is what he wants for his birthday. And I forced him to say, yes, he will. He played cricket every summer, and every Saturday, Sunday, bank holiday Monday, throughout the summer. He played snooker every Monday night during the whole year. And he played football for an amateur team on a Saturday, but he went training midweek. So I hardly ever saw him. I really hated sport because it was like another person in our lives. So I said, you've got to take the boys to their football match for the birthday. And he goes, all right, don't keep on. So he ordered the tickets. And on the morning of the birthday, my daughter and I were going to have a girly day together. She was the eldest. And the boys got their football things on. They were so happy and so excited. And then the phone rang and he comes back to me. He answered the phone, not my son, my husband. And he said, are my whites ready? And I said, whites? Why? He said, they're one man short at cricket. You'll have to take them. I said, but you promised. And he said, it's no big deal. Here's the tickets, here's the A to Z, which is a book of street maps, how to get there. And the boys were crying and they were saying, I don't want to go with Mum, she hates football. And I was thinking, how could you do this? You promised. But he packed his things in that long bag. I could still see it. He walked to the door and he says, best of British luck. And he did that and he walked off. Now I'm left in this place with everybody crying, including me. And so I had to go. So I phoned up various people. I said, can you take the boys? They said, short notice. So I got in the car. My daughter went to play with her friend. I took my Rolleiflex camera, which I'd graduated from the box Brownie. And I was so upset and so angry. And then I was driving and I could see the crowds. I eventually found a parking place. And then I arrived at Selhurst Park. And I'm not exaggerating when I tell you, it was the most absolutely uplifting moment of all the years I'd spent in England, which was dull and drab next to the color and beauty of India. It was post-war, not long after post-war. And there were all these people happy and jolly, and they were wearing the club colors. You could smell all the hot dog stands, and they were selling souvenirs. Even elderly ladies were there with their little bobble hats, dads with their kids on their shoulders. I was thinking, whoa, where's all this been? I've never seen this before. And then we got the tickets, we went in, and my seat was right at the back with the boys. And that picture shows you how far everything was. And when the music started and the players ran out onto the pitch, and everybody was applauding you see how far away I was, and people were jumping up in front of me, and I was saying, I want to sit right closer by. I was so inspired by seeing those grown-up men leaping and heading the ball, and their shirts rippling, their head. It wasn't sort of, oh, I fancy the men. It was the action. It was like what my boys were doing in the garden, but a million times more superb. So eventually knocked on the door. I kept phoning the club. How do I get closer to sit there? And they ignored my phone calls. And I left there about 3 or 4 times. In the end, I thought, I know where Crystal Palace is. I'll drive there. And I knocked on the door. But I got inside and the receptionist, can I help you? I said, oh, my name is High Money. I keep ringing the club. Nobody calls me back. So she gets on the phone and she said, you know that woman who keeps phoning and with a funny name? She's here in person. And then she turns around and I heard him say, send her up. So I went upstairs to the office and I said, please can I have a pass? What do I have to do to go and sit there? And he said, you need a photographer. Are you a photographer? Are you press? I'm saying, no, but I really want to sit there. And he said, he called the secretary and he said, for goodness sake, give this woman a pass and get rid of her. With a name like High Money and a cheek like yours, just give her a pass and get rid of her. And that's how it all started.
So you were the first one to go into the first sports photographer in all of England. So how was that like? As in, like, you were the first one who was doing things in an otherwise man's, there were only men.
Well, because I'd never watched television to see what was going on, I just didn't know, there were no women. It's never entered my head, men, women. I just wanted to do action pictures like I did with my children in the garden. When I went to the press room, I was taken to the press room, they were full of men and they were saying, hello, darling, you got your knitting with you? You brought your crochet, what have you got in your bag? And one guy stood up and he walked towards me and he knocked me over and he said, oh, sorry, sir, I didn't notice you standing there. And they were all making fun of me. Look what she's wearing, what we got here. And I didn't know there was going to be this attitude towards me because I didn't know men, women, I had no idea. So I thought, I don't care, I'll just get out onto that pitch. And then I think I'll show you a photograph of my first at Palace where the goalkeeper's flying through the air and it's all grainy and horrible. Then I thought, that is it, this is what I want to do. And that's where the journey began. And that's where I didn't know there was going to be so many battles to fight.
So how is it overcoming some of that? I think you literally broke the glass ceiling and you were the first one to get a card on the union.
Well, it took a few years, but it took. Everywhere I went, I was made fun of. I was ridiculed by the men. They did some really nasty things, like really nasty, which I can't even discuss here in public. They thought they'd frighten me. They thought they'd shock me. But I started to work at Crystal Palace. When I say work, once I got to the first match, I kept wanting to go back to the next home game and the next home game. And they just let me go. They gave me a pass. They said, oh, just give it a pass. But then I was showing them the photographs because I was saying, who paints the lines on the pitch? Because I saw it with brand new eyes. Who washes all this muddy kit when all the players come out? So I would go back and investigate. Who does this and who does that? And so then I built up this portfolio of photographs, which then they allowed me to put in the Palace program. And then I was set. So then I sent the photographs to the local papers because I always saw it from a different angle. The press photographers at that time would just sit on the touchline and take action photographs, but I would go behind the scenes and investigate because it was also new. And that's how I built up all these images of, for my book, High on Palace. Oh, this, yeah, the camera one is when I got my first Nikon, then elevated myself from a Rolleiflex, from a box brownie camera to a Rolleiflex. And look at me, who do I think I am? Because other women would have jewels and pearls and diamonds, but I was, give me a camera, give me a lens. and this is me thinking I've made it. Look at me. I've got a Nikon F2 with a motor drive, and I've got a lens, 200mm, 300, I forgot what it was. And I could just say, come on, bring it on, boys, bring it on. So
I think you had already made your mark by then. And I think that's the most important thing, especially when you talk of like photography and your book, where the unique perspective that every individual brings, I think makes a difference. And therefore, like you said, being the first woman, you were able to give a whole new perspective to football, which they probably just didn't see.
No, they didn't see, because if you look back at all the football programs, way back, would you ever see in a football program who was two old ladies, no, I shouldn't say old ladies, I'm old now, but two ladies washing with a big pile of dirty football kit and big washing machines? And I would say, why don't the fans know that somebody has got to go behind the scenes after a match is finished and wash all that mud off the kit? Why don't I go behind the scenes? Why don't I photograph who gets this lawnmower and makes these lovely lines? Nobody bothered about them to put them in the program, because people turned up at the match and there were all these beautiful, lines on the pitch with the lawnmower. The men ran out onto the pitch in their clean clothes. Nobody gave a thought about what went behind the scenes. It was a football match. They'd go to the match, watch the game, go home. But I brought into the public domain because I was so curious, because I'd never seen it before. And so I opened up a new kind of format to football programs to bring in families and behind the scene things, whereas before it was just the visiting team statistics, the players of the day statistics, and where they were in the league. But I brought it like into a little magazine and things. So that's why the fans at Palace began to really look forward to me coming there and buying the programs and things. And then at Wembley Stadium, the first time I got my photographer's pass to Wembley Stadium was when one of the Crystal Palace players was chosen to play for England. So therefore, as a Palace photographer, I was entitled to go to Wembley Stadium and take a photograph of Palace player in an England shirt. So I bought 4 tickets for my children. I applied for a photographer's pass, which I got with the name High Money. I put the children where they should walk up to their seats. And I said, when you finish, just stay here, don't move. I'm now going to look for where the photographer's entrance is. And I searched everywhere. I eventually found it. It's a big stadium, Wembley. And there's a guy there in charge with his cap and everything. And I showed him the pass and I said to come through. And he says, "Over my dead body, mate." And I, "Excuse me, this is my name, this is my pass. I need to get through to get onto the pitch." And he said, "Over my dead body." He said, "Is there nowhere you women don't want to stick your noses in?" And I thought, for Christ's sake. Now, photographers who knew me were walking past and they could see this confrontation going on. And I'm actually looking at them with my eyes, pleading, speak up for me. But they looked at me with a smirk as though to say, "Stuff you." And they all walked through. And this guy would not let me pass. And I had to go. And so my children were in the stadium watching the match. I was outside with an official pass with my name on it because I was female. I wasn't allowed in. I can't tell you how angry I was because I could not physically push him. I could not physically because he barred the way. So what I did when I got back, the children were really panicking. "Where's Mum?" They couldn't see me anywhere. So when I got back, I said, "Right, I'm going to join the union. There's a national union of journalists. This cannot go on. I have got to put my foot down." So I got in the forms. I filled every single thing, and I ticked every box. I was legally entitled to join the National Union of Journalists, where this thing could never happen to me again. And what happens? I get banned. Oh yeah, this is a letter I got from. Because when I got back from not being allowed in, I wrote a little piece for the local papers and said, I didn't go big time with the news or anything. I just said I was banned. It was picked up by the Houses of Parliament, and I got a letter from the Prime Minister's office saying, what can I do to help you? And I was thinking, how would they know? How would the members of Parliament even know such a thing? Then I realized that the Speaker of the House of Commons was a member of Parliament for Croydon. Croydon is the home of Crystal Palace Football Club. And he'd heard of me and he thought, this is outrageous. You cannot ban her with an official pass. So I attempted to join the union, and I was turned down by 40 signatures of men saying that I was taking away men's work from them. So they said, you can't join the union. And I said, but I have qualified in every way. So I took it up again. And that picture of me at Wembley Stadium was, I got it there in the end. But I had to fight a big battle.
I can imagine. Going from there, I think apart from you had made it so big in the footballing world, I think you would have taught a lesson to all those who tried to stop you. But then you went on to also cover a lot of other sports and become a really renowned sports photographer, including some of the other icons. Who are some of the favorite people that you have shot with outside of football?
Well, I thought, after about a few years, I said to myself, do you know what? Why don't I have a go at tennis? I've got a union card now. I could apply for a photographer's pass at Wimbledon tennis. So I did, and I got a rover's pass, which meant you can go to any of the outside, but you can't go to centre court. So I went there for the first time, and I entered the press room, and it was huge because it's an international event, and it was pouring with rain, and I was like a drowned rat. And when I walked in, I was getting, where do I get a cup of tea? And in the corner of the room, I saw the British press mob, the photographers, the Rat Pack, and they were playing cards. And I was so scared. I was really scared. I'd never been to Wimbledon before. So I went there and I got a cup of tea. And I noticed that they'd clocked me, they saw me, and their faces when they looked towards me and saw me standing there. So I walked towards a window with a cup of tea, and I had my back to them, and the cup was shaking in my hand. And I was saying, don't let them intimidate you. And a man taps me on the shoulder with an American accent, and he said, pardon me, he said, can I ask you what you've done to upset those guys? And I said, what guys? And I turned around and he pointed. And there were the press gang looking at me. And I said, I just walked in, I've got a cup of tea, and I'm just standing here looking at the rain. And he said, they said that if you as much as set foot the football or the tennis court, they will stage a mass walkout because they tolerated me at football. They said, fine, we compartmentalized her in football. Now she's bloody well entering the world of tennis. We're not having that. So I then got so scared. I really couldn't cope. So I had my tea and I went running out of Wimbledon. And on the way, I was looking up at all the ivy-clad buildings, and there was this picture and I saw this lady looking out the window. Have you got the picture of Sue Barker? And she's waving from the window, and I went, click, that's a nice picture. And she waved at me. And then I thought, that's a good picture. That's it. And she's a very famous her name is Sue Barker. And I thought, that's a really nice picture. It's pouring with rain. She can't play. She's in the ladies' dressing room. So I drove to Fleet Street, and the picture was published, whilst all that lot was still sitting there, having their cup of tea and playing cards, moaning about me. So, and another occasion at Wimbledon was when I photographed John McEnroe on the occasion of when he'd won the previous Wimbledon championship, and he'd come back and he was playing in one of the outside courts. By this time, when I went back again, I just knew what the setup was. I knew how to prepare myself. And so I was in the outside court with McEnroe, and he lost, and he was a champion from the year before. He'd lost in the first round, and I knew it would be a big news story. And I was driving home from where I'd found where I'd parked my car, and as I'm driving past the entrance to Wimbledon, the police stopped and they let all the cars from the club just leave. And then they said, beckon me on. And right in front of me, I said, that looks like John McEnroe in the back seat of the car. And I got my camera like this, it's always on the side, and I'm zooming in, and I could see, but as the windscreen was reflecting all the trees, and he's got his head on a woman's shoulder, and I said, that is John McEnroe. He's just been knocked out of the first round. That's going to be a big story. And if only I can get this picture of him with his head leaning on a woman's shoulder, but I couldn't do it because of too much of the tree's reflection. So I thought, well, give it up. So I'm driving home, and then I should have turned left, but then I thought, you know what, I just follow McEnroe and see where he's going. Where is he going to land? Where is he staying? And I followed and followed, and I never follow people. It's not my scene. And I think they knew after we'd left the Wimbledon area, that it was heading back towards the Heathrow airport. And I thought, Christ, where am I going? And then he pulled it in to a hotel. And I thought, I've got so far, I might as well follow him. So I got there, and I was shaking because I am not a paparazzi type photographer. But I thought, I followed him all this way. I can't believe I've done that. So I just opened the car door. He got out of his car, opened the back of the car, and he got his bag out of the boot. And instead of just photographing him slyly, like you should have done, I walked up to him and I said, excuse me, Mr. McEnroe, do you mind if I take your photograph? I asked really nicely. And he said, you see this down here? And I looked down like that, and it was a cigarette butt. And he ground his heel into it. And he said, you are effing lower than that. And I said, I'm so sorry. And I just picked up the camera and I just did one picture. And I said, I'm so sorry. And then I got in my car and I was shaking. Driving home, then I heard on the radio, John McEnroe's big news, and he's gone into hiding. And I thought, I know where he is. So by the time I drove home, we didn't have mobile phones and things then, and we didn't have digital. I phoned the Daily Mirror, and they used a lot of my pictures. And I said, I've got an exclusive photograph. And they sent a motorbike messenger to pick up the film. And I was keeping my fingers crossed because I only took one image and I was shaking. And I said, on conditions, you give me a byline, because I'm sick and tired of you using my photographs. You never give me a byline. And this is a big story, and I've got you an exclusive. Yeah, we give you a byline, hi. I got the paper next morning, back page, McEnroe, exclusive, no byline. So that's the kind of thing. And at the corner here of the big picture here, you can see McEnroe shouting, "You cannot be serious." So there we go. These are loads and loads of little anecdotes.
You've overcome a lot of, those difficulties, and you actually earned a nickname called Mama Razi, if I'm right.
Yeah.
And now that you've been in the scene for so long, I think when you came on to shooting football, like you said, there were hardly any women in the scenario itself. And today, obviously, it has come a long way from that. What are some of your favorite images now?
Oh God, there are so many. And now another thing is there's a picture of Borg here on that. Oh yeah, this is a picture of Borg. Now, what most photographers would do, they take all their photographs and then they just leave. What I would say to Wimbledon, I would go down to the press interview. They didn't say no photographers allowed, it was just press. So they're firing questions at them, and the way that the people react, they either angry or there's much better, and I know that no photographers are there. I've got exclusive. I don't know why they didn't just do what was on the pitch or on the centre court. I don't know why they didn't just go down and follow it through and then see them drive off in the car with police escort. I mean, I'd like to tell a story through. So I got a lot of exclusive like that. And this is the photograph I took last year at the Football of Their dinner, which I go to every year. But of course, we didn't have one this year. And for the first time, I couldn't believe it, but they had given a woman an award. What was her name? I've forgotten. Oh, terrible.
Kelsey something.
Anyway, and this is the male photographer who is from Liverpool. You've got me on the spot. I wrote their names down, but I can't think at the moment. So this is last year. So it's good to see now that, I mean, the women footballers, they are so famous now, aren't they?
Yeah.
The Lionesses.
Right. Sorry, I think we have a little bit of time left. So I'm going to ask you about your two favorite images. So I think you shared like one of them with me. So can you tell us a little bit about this?
Yes. Well, I just love when I look at the kit today at the football matches. I look at the players' kit, and every single square inch of their kit, from their socks, the collars, the cuffs, right down the front, the backs, is just full of advertising. It is plastered with advertising. I just love this picture because this is the England team. They just, in the days when they just wore a number on their backs and the England logo on their shirts. And to me, I just wished that it hasn't gone so far the other way, because they need the money. So even on the bands of the socks, there's an advertisement everywhere. So I love this because also today when they score a goal, they do all these theatrics, they skate, they jump, they leap, they pump. This is dignity. And it showed they'd scored a goal and they'd won, but it's I just love it. Maybe nobody else does, but it's not hugely an action photograph, but it's very, very nice. And
I love the image. I love the image too.
Oh,
I think
good.
you said that if you had to sum up your career somehow in one photograph and you shared an image with me, please tell me why that is so special for you.
Oh God, yes, because I was telling you about my daughter Lisa, the very first photograph, and then I photographed the boys in the garden. Well, this little baby girl is the granddaughter now of my son Martin when he was 7 years old, and he said, I said, what do you want to do for your birthday? And he said, I want to go to the palace. And then it all kicked off from there. And last weekend, just before this COVID thing started, she came down to visit me. I saw her for her first birthday, and this is her second birthday. And I said, do you know what? Here's a football. I'm going to teach you to kick a ball. And it's like her dad and her granddad's 3 generations now of football monies. So this is Lola Money kicking a football. And I am still taking photographs, and I'm still around to enjoy the actual art of photography.
Correct. No, I think that's, we're running out of time, but I think it's been amazing from where you started to where you are now. And like I said, we would have never had the chance to meet otherwise, but I'm so inspired because coming from such a diverse age gap, I think we were like initially told to talk about the differences in photography. But I think the passion for capturing the moment and capturing photographs which kind of freeze time has helped you also, retell your story throughout. And I think that's something that we share in common. I'm going to hand it back to Kalpana to ask you one more question that she was saving for you.
Thank you for being such a wonderful host and helping me along. I can't wait to hear about your story as well.
Thank you so much, Hai, for sharing your story with everybody. I think now are we doing a question and answer? As I hand over to Kalpana, she'll take over from here.
Hi, Mandappa. Hi. Thank you both so very much for that very, very great conversation. Hi, it has been a pure pleasure to have gone along this journey along with you, and you've had such an inspirational life. I have a question for you. What advice would you give yourself, your younger self, or people currently leaving from school in Lovedale to take on life the way you have experienced it, you have fought it, you have journeyed it? What would your message be to them?
Oh, it's such a good question, because what I did in my life, it wasn't planned. I had to sort of think on the spot. And I would say, just remember always, never give in. I don't think I could have survived even Crystal Palace, let alone Wimbledon, let alone boxing, everything, if I had not just reminded myself. They taught me in school, never give in. And this is what I would say. And I am so grateful to my background of Lovedale School. It has seen me through some of the most horrible times. And look at me today. I'm still standing. I'm still smiling. And I'm still talking through this Zoom stuffy, which most people my age would say, well, I did have a panic when I couldn't get this sound on, didn't I? I actually burst into tears. That shows what a big girl's blouse I am. But that's what I would say. I would say, really believe in yourself. When you have everybody just bashing you down, just believe in yourself. Because if you don't believe in yourself, who's going to believe in you? Absolutely. And they taught me that at Lovedale School. So that's what I'm so grateful.
Thank you. Thank you so very much. It's been a pleasure. It's been a joy. And I cannot tell you how much I have been inspired by being in conversation with you and in preparing for this session as well. So appreciate it very much for your time, for your patience, for everything. Lots of love to you.
Oh, you too. This is really a big deal for me because, I'm doing all this technical stuff. You saw how panicked I got, didn't you, Rohan?
Well, it's not only you. We panic as well. 10 minutes before you panicked, I was jumping up and down because of the fiber optic cable. So there's always something. And but think about it. We are in how many countries? Kalpana is in Atlanta. You're in London. I'm in Kuttaiah. We've got guys in Houston and Australia, and everyone's all over the world. But here we are connected on this this platform. So. We learn everything once, and it's never too late. It's never too early. Just like you say, just get on with it. And you asked me how one of the reasons I got in touch with you was, Kalpana, you remember we had Saz Agarwal some time back, and when we were preparing,
freezing.
It's freezing.
Yeah. Mm.
Oh boy.
Oh God, I'm so cold. That's why I've got my shawl.
Okay.
Okay, sorry.
No, it's okay. And so she talked about independence, and we were preparing the August session. And one thing she talked about is like, what about we speak about Old Lawrencians in the 50s and 60s and 70s, and they are doing all sorts of stuff. What about those folks who left India around that time of transition? And I remember during the prep session, you talked about the 14th of August, 1947, which incidentally is a very special day for you, right? So we still have some extra time actually, because we had planned a little bit more time. So maybe, one last cute, it's a very relevant, very special story. So we'd really like you to share that with us.
So the 14th of August is my birthday. And on the stroke of midnight of the 14th of August, like the birth of the 15th of August, the split second, it was my birthday. I'm laying in my school, I nearly said hospital bed, laying in my, felt like it, laying in my school bed, no talking off to lights out. And all of a sudden there was this noise that was going on outside. And I was really frightened, thinking, what is going on? Of course, it was independence. And from the split second of the 14th of August ending, that India was celebrating. And it was my birthday. And I found this letter and it said, Mummy, darling, did you write to me a letter? Because I was really, really sad and disappointed because you didn't write to me. But I suppose you were very busy. And it said, today, this is Independence Day. We started Independence Day by getting up very early, then going to the hoisting of the flag at the flagstaff while the band was playing Jana Gana Mana. We also in the morning had a Pagal Gymkhana, but neither of us won anything. The best part was a mixed hockey match between boys and girls. I was chosen to be one of the 11 girls. It was grand fun. From 6 to 8, we went to a dance. And this is another thing. This is my sister Colleen. My mother kept every single letter we wrote. And this is historic because we always used to write LMRM School, Lawrence Memorial Royal Military School, at the top of every letter. And if suddenly now, independence, and it has to be scratched out. It's not Royal Memorial anymore. It's called Lawrence School. So my sister had to scratch it all out with her pen, Lawrence Memorial. So I think that is quite interesting, isn't it? I should find it. So yeah, I was in Lovedale School when it was Independence Day. And I thought, what the hell is going to happen to me? I'm not Indian, I'm not British. I'm in between, I'm not Hindu and I'm not anything. It's just finding a little niche to where I belong. And unfortunately, the only thing I found was Crystal Palace Football Club. And that's where I belong, to this little group. It's not religious and it's not political. And it's an odd thing after all my wonderful education to say this is where I belong, Crystal Palace Football Club. Quite sad.
Great life. Great life, Hi. Very great.
So it's rocking, and we've really enjoyed. So I think there's so much that goes on before the session, right? And over the last couple of months, we've really enjoyed getting to know you better, hearing all the other stories folks don't know. That's just our secret. But I think the purpose of putting these sessions together was to inspire. And if you see our logo and the theme is never given, and almost everything in your story is based on that foundation of never given. And I think that's what this is all about. And it's really.
I have never ever gone to anybody and said, help me out here. I've never gone to anybody, because each time there was an obstacle, I said, deal with it. Because you do that in school. You might be bullied by somebody. You can't go, Mummy, he's bullied me. No, you just deal with it and you get over it and you cope with it. And that's all the way through my life, even right up to now. I'm dealing with this.
And is that your message? Is that your message to the young? There are several young current Lawrencians, boys and girls, including my two girls, probably listening in. What is your message to these youngsters as they move into? You heard about the new education policy. That's something new, and so on and so forth. What message would you pass on to them?
I would say, if you have a dream, no matter how much rocks are thrown at you metaphorically, if you have a dream and you think you could do it, and even if other people say you can't, but if you believe in what you think if you believe you can do something, and no matter how many obstacles are in the way, just keep a little step at a time and just keep going, because you get there in the end. And because that's all to do with never give in. just believe, I truly believed that I could be a photographer, because every photograph tells a story, and was my thing.
Yep.
So that's what I would say to them. Believe
Thank
in
you.
yourself.
Thank you.
Believe in yourself. Thank you so much. Thank you very much. Hi. And Kalpana's left. Thank you very much, Kalpana. And here we are at the end of another session. And as always, we will have a few people to thank. So this is something interesting. You can see our OL Nation working group. That's Atul Veer on the top. He's in Houston right now. Rashid Kapadia in Houston. Kalpana Kuttaiah, of course, Kalpana just left. She is based in Atlanta. Murad Lala, the oncologist and mountaineer, Mount Everest. He's based in Bombay. Myself, Rohan, Vindhya 86. Hey, there are so many Vindhyans on this panel, huh? Nikhil Bujwani in Boston, Dinesh Arab in Daytona Beach, Adrian Kennedy, professor in Ras Al Khaimah, and of course, Captain Arjun Nair, who is right now working behind the scenes, keeping me on time. Thank you, everybody, for coming on our show. We've got a couple of housekeeping things, dates to remind you of. 10th of October is OL Assembly. And of course, 24th of October, we have a very special session on entrepreneurship. We have Atul Veer, Samir Sood, Abhishek Mohan, and a few more people to talk about another way of starting your career and the other options that are available and the resources. And we, as old Lawrencians, who have done a lot of stuff in our life, we are more than happy to help you young guys make decisions, coach you, mentor you, support you, and even participate in various things that you guys are doing as you move forward in your careers. As the headmaster said, it's all about experiential learning, and we are there for you. We also need a couple of volunteers. You would have heard and noticed that we have issues with technical staff. So, we need people to help us. You help us, help you, and take care of yourself. Thank you once again. Have a great evening, ladies and gentlemen. I wish you a good night.